We want to look at people starting well, living well and ageing well. And I think that's really important because we're looking at the whole life cycle of an individual who lives in Merton and making sure we do absolutely the best for them.
Today I've mainly focused on the conversations about mental health because personally that's something that I've suffered with this last year. I'm hoping that I'm going to be able to influence plans, and that feels amazing because it needs to come from the people themselves that are suffering with these things.
I just think it's been very lively, very engaged people, and great to get so many people together to talk about these kind of issues.
The energy in the room is just incredible. There's more than 100 people here, people from all different walks of life. We've got people from the council, obviously, from the NHS, from different voluntary and community groups. But we've got an awful lot of people here who are talking about their lived experience, and I think that's just so powerful.
I'm here because I want to get my view as a young person living in the borough of Sutton across to the people who are at the top. And I feel like it's very important because we're the next generation, so the changes that are happening now are going to affect us, and we should have a say in how our future is shaped.
Thank you for actually giving me the opportunity to actually stand in, give my voice across as a young person in Sutton. So thank you for that, and for actually accepting what was being said by us as the young people and sort of taking it in and trying to, change the future for everyone as well. So yeah, thank you for that.
I think we need to work as a system, we need to work on integration and how we can work together to make healthcare and social care in Richmond even better than it is.
How do we make prevention everybody's business? How do we create healthy communities? How do we reshape healthy lifestyles and services to enable people to think about how they can look after themselves better? And then, how can we prevent, reduce and delay the demand for health and care?
So I've come to this event today to listen to members of the public and hear some of their ideas about what can make Richmond a more healthier borough and what can we do to improve some of the services that we already have.
What I really want to get out of today is to be able to hear firsthand what carers and patients and the public feel about services within the Kingston Borough and how we can create a better system for the patients to be able to navigate in.
We have to do things differently, and I sense there's a real commitment to trying to do those things differently.
What's important is to have people from lots of different backgrounds with lots of different health conditions and situations to really feed in a variety of views.
My particular great concern is the rise of mental health for young people at school. We've got a lot of young people that are being excluded because their bad behaviour has just escalated, and we're struggling to know what to do really.
Everybody who lives in the borough knows that if we're going to have great healthcare and services, then we need to get things more joined up. So today is about not only asking ourselves what are our main priorities, but then also the different people here, it's how can they then work together in a more partnership fashion to actually do a better job of delivering on the ground for local residents.
This health and care event has been really great. We need to improve or increase our collective work across health and care at all levels, and it not just be something we say, but that we actually implement it.
Making sure that our Croydon residents and people who use health and social care services can access the care that they need when they need it, and that their experience is as good and as seamless as it can be, is all of our responsibilities.
What's really good about today is we've got the local authority and we've got all of the health system as well as local people and practitioners coming together, because we're not going to make a system that really joins up unless we all come together.
This is about shaping our future and doing it together, and that is from every single discipline, people of Croydon, specialists in Croydon, health, social care, local, everyone together, forming a vision for where we can move forward as Croydon.
I'm a care assistant for people with Alzheimer's and dementia. I just kind of want to thank everyone actually, because I didn't think that I would actually learn so much just from coming. I think it's actually going to help me change the way I work and the way I do things at work and the way how I handle different situations, so thank you.